We are here today to update you about the status of our efforts to fight the COVID-19 virus here in Nashua, and to let you know some of the things we're looking forward to in the future as to what actions we can take to contain the spread of the virus. First of all, I want you to know that there is a group of people, a team of people from Nashua who are working very hard to keep you safe while at the same time delivering services to our citizens and residents. Our police department, our fire department, public health, everybody is working very hard. And I'll tell you a little bit about that team effort in a minute. Right now, as of this morning, Nashua has 115 COVID-19 cases. Some of those people have recovered. Unfortunately, 7 people have passed away. And there are right now about 54 active cases. Our health department, and I will describe this a little bit more in a second, but our public health department is following each one of those cases, as well as the contacts which each of those victims has had over a period of time to see who else might have been exposed to the virus. But what we're doing in order to try to contain this is we're trying to box what we're saying is box the virus in. Now, as we look at Nashua's situation, we are in relatively good shape. Right now, our hospitals have about 10 active cases hospitalized, 10 people hospitalized. Unfortunately, some of them are on ventilators, and I do personally know one of those people, and each case is definitely a tragedy. But if we look south, just across the border, we see that the hospitals in Lowell and Lawrence are much closer to being overwhelmed with the number of COVID-19 cases. So we are very close to areas where hospitals are nearly overwhelmed. So we want to take every effort we can to box the virus in. Now, this involves 4 things. First of all, we need widespread testing, and we're working towards that. In a conference call with the governor yesterday, he talked about the state's efforts to acquire more tests. One fast test from Abbott Labs and other tests as well. But the competition for this is very steep. There are other states like New York and Massachusetts where the outbreaks are far more serious, that are demanding and needing many, many thousands of tests. So it is hard to acquire these tests. Unfortunately, there does not seem to be a national strategy regarding requiring industry to produce more testing, but I believe that ultimately we will get to the point where testing is more widespread. Number 2, and that is to be able to figure out exactly who has the virus, because we know that many people who have the virus are not symptomatic yet, either because they never will have symptoms but are still contagious, or are in the early stages of the disease and therefore are contagious even though they haven't yet developed symptoms. So we want to identify everybody through testing, and we want to isolate the affected people. Then we need to have groups of people like our public health department is doing now to track down all of the contacts that each positive person has had, each person who's tested positive for COVID-19, track down all their contacts over the few days before their symptom, and talk with them about quarantining themselves so that they, who might also be positive, will not spread the virus to anybody else. And as I said, then the final step is to identify people who might have been exposed and get them to quarantine for 14 days. Now, we've started on this, and our public health department is doing a great job with this. And you're going to hear it later from public health nurse Kim Bernard, who is going to tell you about everything they're doing to track the contacts and the cases that we have here in Nashua. Again, right now, we only have 54 active cases, but that's because there hasn't been a lot of testing in New Hampshire at this stage in our efforts to fight the disease. But our public health nurses are working 7 days a week to track every case and try to identify every contact. In addition, the public health department has been conducting testing at a congregate care site, the Huntington, which you might have heard about in the news. Yesterday tested all the employees and even more residents that had previously been tested to try to make sure that there's not further spread of the COVID-19 virus down at the Huntington. There's been a huge team effort, as I mentioned. I would just want to mention a few people who've just really put forward an incredible effort. For example, there's an organization in the city, Make It Labs. Now, this is what they call a maker space. What they do is they're a group of people. This is an informal organization. They do have a place of business, but it's all volunteers. And they are very dedicated to making things. And they worked with Southern New Hampshire Medical Center to develop a unique shielding device that will shield the nurses and the doctors at Southern New Hampshire, that can be made here locally. And what they do is, and that has helped Southern New Hampshire protect our nurses and our doctors from exposure to COVID-19. But I want to thank Make It Labs, and it's an example of many people who've been pitching in. There are teams of people who are sewing masks. Latha Manjaputi, Trish Klee, others are sewing masks for use around the community. We've also had a group of people, organized volunteers by United Way, is delivering meals to kids that don't have sufficient meals when schools aren't open, as they aren't right now. They're delivering 4,000 to 5,000 meals per week to kids who need food all around the community. Now, looking forward, there's a lot we need to consider. First of all, we want to think about how we can work in city government more safely and more effectively. We might be involved with more teleworking. We might stagger hours. These are all possibilities, and certainly position people further apart. All of this is designed to prevent the spread of the virus as much as we possibly can. Because when someone comes into City Hall, either works or visits, that creates the risk of exposure. So we want to make sure that we work as safely as we can looking forward. Also, we want to try to help our businesses and our employees recover from what we know is going to be a very significant economic downturn. Right now, all of our restaurants, our hair salons, our bars, other service businesses are closed, and we have a number of employees who are laid off or furloughed. I want to thank, of course, all of the federal delegation, the federal government, for helping with extra unemployment insurance for the people that are out of work. Still, that's slow in coming, but eventually it will get here, I believe, and that's a great service for the people who are out of work. But we need to help our small businesses and our nonprofits who've been affected by all this get back on their feet. So we have developed in the city a proposal to start a COVID-19 impact fund. We will be assembling some federal dollars of about $1,200,000 that we will loan in small loans to our smaller businesses and grant to nonprofits to make sure that those who have been severely affected by this the economic impact of all these closures can get get back on their feet. So these are some of the things that we're working on. Now, we have 3 other people, city employees, that are going to speak with you today. All have been extremely dedicated to helping our community, and I want to thank each one of them for everything that they've done. First of all, we're going to hear from Kim Bernard, who's a public health nurse involved day-to-day, 7 days a week, in tracking the virus, tracking our positive cases, helping the people, caring for the people who are suffering from coronavirus, and locating and identifying all the contacts so that the spread of the virus will be limited. So you're going to hear from Kim Bernard. Then you're going to hear from Justin Cates. He is the city's emergency management director. He's involved with planning, strategizing, and implementing the city's plan for dealing with the coronavirus in terms of all of the steps we've taken to work remotely, deliver services even though City Hall is closed, identifying who essential and non-essential employees are, helping us decide who can work remotely, and also working on developing the alternate care site, we call it, out at the high school, Nashua South, which is where we have a site where if the hospitals become overwhelmed, some hospital patients could be moved there. So you'll hear from Justin Cates, Emergency Management Director. And you're also going to hear from Tim Cummings, who's the city's Economic Development Director. He's planning for the future in terms of the coronavirus or the COVID-19 Impact Fund I spoke with. He's constantly talking with small businesses and large employers in the city, trying to decide how we can the best steps we should take in order to help our business community recover and move forward once the business closures gradually are ceased and business begins to reopen. In any event, if you have any questions, we have a coronavirus hotline at the Public Health Department, or you can call the mayor's office. We're still working remotely. Again, I want to thank everyone who's been involved in this effort, all of our city employees, the people you're here from, our teachers who are teaching remotely, as well as especially our nurses and our hospital workers, our healthcare workers who are on the front line, so to speak, every day, who are risking exposure and whose families could be exposed to the virus. So I want to thank everyone who's been involved for the last number of weeks. And with that, I'm going to turn it over to Kim Bernard, who's one of our public health nurses, as I said, who will talk about the efforts of public health.
Thank you, Mayor. Again, my name is Kim Bernard. I'm the Chief Public Health Nurse for the city. I am going to first off give a data update regarding COVID-19 cases. This data is current as of last evening, 4/16. Worldwide, there is over 2.1 million cases right now. In the US, it's over 672,000 cases. In our state of New Hampshire, there are 1,211 cases, with 71 new cases reported in the past 24 hours. In our community of Nashua, of the 483 in Hillsborough County, there are 111 of these cases affecting our Nashua residents. In Nashua, 38% of residents who have COVID-19 have recovered, 15% have been hospitalized, and 3% have died. There are currently 50 active cases that the public health nurses are investigating, and an additional 98 contact tracings. The Nashua Public Health Task Force continues with mitigation measures. These include things like testing, case investigation, and contact investigation, social distancing, and staying at home messaging. We continue to work with our community partners to maximize strategies. This also includes our daily communication with our community healthcare organizations. As the mayor mentioned, we continue to staff the COVID-19 hotline for any citizens that may have questions surrounding COVID-19. The number is 589-3456. Again, that's 589-3456. And this is manned from 8 a.m. to 9 p.m. 7 days a week. Thank you.
Now you will hear from Justin Cates, Emergency Management Director.
All right, good afternoon, everyone. I appreciate the opportunity to give you an update on our city's response to COVID-19. So you've already heard a little bit about the Public Health Task Force response, which is one of our 7 task forces that were established during this incident. And after I speak, you'll also hear from Tim Cummings, who will give an update on the Economic Recovery Task Force and some of the work that they've been involved with. So I'll give you an update on the remaining task forces and what has been involved over the last week. So first, community distribution. Our community partners have continued to supply meals out into the community for both school children as well as vulnerable populations. Many of those programs that have been supported through the United Way, Nashua Soup Kitchen and Shelter, Southern New Hampshire Services, Nashua School District, as well as the Nashua Transit System to help distribute those meals have been going on and are becoming very successful. One of the things that we did want to note is there's been a discussion over the last week around the summer meals program for children. Now that school is looking to be out of service for the remainder of the year, we're going to try and expedite some of the planning around how COVID-19 might impact the summer meals program, and if there's any sort of opportunity to expand that program to be able to support more people in need. The next task force I wanted to mention was the Child Care Task Force. Megan Karen from the Arlington Street Community Center has been leading that task force and keeping a good tab on the status of child care facilities, as well as the need from our essential employers in the community for child care services. We've been referring those that are looking for emergency child care services to Child Care Aware New Hampshire, who can provide a connection between those child care services that are remaining open as well as those who need child care services. The next task force is school issues. Dr. Mosley from the school district has been leading that task force, and as we expected, a major announcement was made this week by the governor around the continuation of remote learning for the remainder of the school year. We hope to have Dr. Mosley on a future press conference to give an update as to some of the school districts' work around how remote learning will continue in the foreseeable future. The Municipal Continuity Task Force has been very active over the past few days now because there's been a lot of discussion about reopening. Now, I want to make it very clear, and we've been talking about this within the city quite a bit. We're not anywhere near reopening. There's still a lot of work that needs to be done, both on a public health standpoint to ensure we have the right testing, the right measures in place to be able to isolate and quarantine people, as well as an ability for us to quickly identify when there's been an outbreak. While our public health task force has been doing a great job at handling the surge capacity necessary to this time, there's still a lot of work we need to be able to do as a city, as a state, and as a national level to be able to deal with the future prospects of reopening our communities. So we'll continue in the next week to work with division leadership around what it might look like to reopen here within the city, while also maintaining those critical services that you've still been receiving over the last month. And then the last task force, just for an update, is the Homeless Support Task Force. One of the things that our welfare officer, Bob Mack, has been working with working with the state around the possible option to utilize the Daniel Webster College facility as a surge capacity for our homeless shelters within the city. So we're working currently through that as an option and hope to have more information to provide to all of you in the coming week. Just to close out, before I turn it over to Tim to give an update on some of the great work that he's been doing, I think it's important for all of us to really ensure that we're following the stay-at-home order as we continue forth now with probably the 5th or 6th week of the COVID-19 incident. I think it's really important for us to recognize the incredible work that all of you have done on helping to flatten the curve. I think if we weren't to have done those types of measures early on, we'd be in a different situation when it comes to our medical capacity at the 2 hospitals, as well as a need to open up the alternate care site. At this time, the alternate care site stands by as a resource for us if we need it, but hopefully we won't have to open up that facility as long as people continue to heed those stay-at-home warnings. Thank you very much, and I'll turn it back over to the mayor.
Thank you, Justin, for everything you're doing. And now we're going to go to Tim Cummings, who's going to talk about helping to build a stronger post-COVID-19 economy.
Thank you, Mayor. Again, Tim Cummings, Director of Economic Development. A little bit on the economic landscape of Nashua. My office has been doing a lot of outreach over the last few weeks. We've spoken to a large number, predominantly most of the large employers, representing a little less than 16,000 employees. The feedback we've gotten thus far is that things are pretty much in a stable condition right now, and at least for the near term, things seem to be going in a satisfactory condition. Supply chain is good for a lot of our employees, and that was good to hear. Our sectors are diversified, and so between the high tech sector, the advanced manufacturing, defense contracting, financial services, they're able to be diversified enough that we're able to weather the storm, and that has helped us not see as many layoffs and dislocation of employees as other parts of the country may have experienced. A lot of our employers are essential, and they are providing critical support either to the federal government or in other ways to the life science and hospital industries. So we do actually have more employees working in this region than in other parts of the country. Additionally, one of the things we have heard that is something that we need to be aware of and develop some strategies on is childcare, and developing a long-term plan for childcare, especially not only for the first responders, but for essential employees, as we now know that schools are being closed for the year. We've developed some tools locally, which folks should be exploring, and you can get them from our COVID-19 resource page, and they essentially can be self-reporting guidelines, self-reporting avenue for letting folks know which businesses are open or closed, or if they have modified hours of operation. And there's an essential employee form as well on that website, and you could fill that out and self-identify yourself as an essential employer. And that helps us at the local level keep track of those businesses that are in operation. On the small business perspective, that there is a greater impact on our independent small businesses. Those are businesses that do not have a strong cash reserve position, and this type of disaster is impacting them greater than some of our larger employers. So moving forward, we need to be cognizant of that. We've outreached to many small businesses throughout Nashua. We host a weekly call that averages about 40 participants every Thursday. We're doing this in conjunction with the Chamber of Commerce, Great American Downtown, and we've been fortunate enough to have the SBDC on the calls recently, providing timely and good information. The relative general condition for our small businesses is something that we're going to need to prioritize because the condition is not good. And it's something that we need to be very much aware of. Just to give some perspective, The unemployment rate was projected by Goldman and Sachs last week to be somewhere between 14 and 16%. If that projection holds to be true, that is approximately 50% higher than what was experienced back in 2008. So we need to be aware of this moving forward. We have developed an economic recovery task force with various stakeholders who are involved in economic development. We meet virtually, and we are developing tools and strategies at the local level to hopefully implement and prioritize some relief moving forward in the coming weeks as we look to open back up. This has been a group of public and private stakeholders, as I mentioned, both the Chamber of Commerce, Nashua Regional Planning Commission, local residents, and some bankers. And it's been a group that's been meeting a couple times, and we're looking to develop strategies moving forward to help give guidance at the local level on how we can be able to get Nashua back up and running faster. One of those strategies is something that the mayor just mentioned a few moments ago, and that is the capitalization of a new program called COVID-19 Impact Relief Fund. We're using federal monies, so this does not have any impact at this time on our general fund. This is using resources that are already available to us through CDBG and an Economic Development Administration grant. We'll be using these funds to help small businesses and nonprofits with either grants or loans, and decisions will be made on a case-by-case basis. More often than not, nonprofits will qualify for the grants. We're looking to average somewhere around $25,000 per grant. Some small businesses may qualify for this grant if they are CDBG eligible. Again, decisions on this will be on a case-by-case basis. I should note that this is a pending piece of legislation that needs to be approved, and once it does become approved, we'll be able to make applications available. We're hoping that this will occur sometime in early May. The process will be using an existing program that we have up and running. We have a local revolving loan fund program. We will be using that resource as a way to distribute the funds, and we've incorporated some community development participation. So with the idea of being able to get money out to Nashua at the local level as quickly as possible. Overall, we're just beginning now to look at our recovery plan, and we are hopeful to develop a phased approach that will bring Nashua back even stronger. Thank you.
All right. Well, thank you, everybody, for all of your efforts. Thank you, Tim. Thank you, Kim and Justin. We will attempt to update you periodically. Probably do something next week. We're doing this remotely, as I said, because everybody is trying to maintain the physical distancing, limit the spread of the virus. And so we will be back to you in a week or so. Thank you very much.
All right, thanks everybody very much. Adam, did you want to ask a couple of questions?
Yes, I did have a quick question. Yesterday during Governor Sununu's press conference, Commissioner Shibinetti said that there will be a mobile test site going on in Nashua on Tuesday next week for the community. I was curious if anyone was able to provide any details on what that would entail.
We are actually talking with the commissioner and other people from DHHS later today to talk about the details of how that's going to be carried out. Now, one problem is that we believe, but we're not sure yet, we want to hear more, we're only going to be allocated 75 tests. So we expect that it will be by appointment only, and because we can only do 75 people, if I'm correct, if what we're hearing is correct about the number of tests. But we are going to be getting more information about that, and so I can't give you complete information yet. We're going to be getting more information today and maybe over the weekend, and developing the plan between now and Tuesday.
Mayor, I could just add to that, if I could.
Anything else?
I think Kim Bernard was looking to speak to that.
Kim, go ahead.
Hi, Adam. Thank you, Mayor. So this testing site is going to be available, like the mayor said, by appointment only through the Nashua Division of Public Health and Community Services. And we will have a limited number of tests available. We ask that if citizens do have a health provider, if they could please contact their health provider to discuss testing with them.
Thank you. Yeah, I was curious as well with the Huntington and Nashua if there's been any additional positive COVID-19 cases or any additional deaths.
My understanding is no additional. Well, maybe Kim can speak to that. Why don't we turn that to Kim, because she's watching these cases individually.
Sure. Yes, Adam. No, we do not have any more information on anyone that has tested positive as of now, or deaths.
But you did do a whole group of tests yesterday.
Correct. So those results are pending.
So yeah, employees and additional residents to try to identify if there's any further spread.
Correct. And those are pending.
These were, I think, asymptomatic people. So it was just people were tested, just generally tested.
Yes, all of their staff and some residents, correct.
Adam, do you have anything else?
No, I think I'm all set. Thank you.
Okay.
All right, thanks, Adam, and thanks, everybody. See you soon.
All right, thanks everyone. We'll see you next week.
Hey everybody, this is Koli Ai. Doing a quick PSA for the mayor's office. Wanted to make sure that everybody is staying home and staying safe. And if you need to go out, do something essential like some exercise or go grocery shopping, make sure that we're practicing good social distancing techniques. That you're staying 6 feet apart, wearing your mask, and washing your hands as much as possible. Hopefully everybody stays safe and we can all get through this and get back to life as normal as quickly as possible.